This is a video presentation by Health Principles on uterine fibroids. I bet you didn't know that uterine fibroids are a common health concern for many women. These growths are non-cancerous tumors that develop in the uterus. The uterus, or womb, is where a baby grows during pregnancy. Fibroids are made of muscle cells and other tissues that grow in and around the wall of the uterus. Many women develop fibroids at some point in their lives. They are most common during the childbearing years, but can occur at any age. While some fibroids are small and cause no problems, others can grow large and cause a range of symptoms. The good news is that fibroids are treatable, and there are many options available to help women find relief. Uterine fibroids are classified by their location within the uterus. This helps doctors understand how they might affect a woman's health and pregnancy. Intramural fibroids are the most common type. They grow within the muscular wall of the uterus. Subserosal fibroids grow outward from the uterus. These can sometimes press on other organs in the pelvis. Submucosal fibroids grow into the uterine cavity. This is the space where a baby develops during pregnancy. Pedunculated fibroids grow on a stalk or pedicle. They can be located inside or outside the uterus. While the exact cause of uterine fibroids is unknown, several factors can increase a woman's risk of developing them. Genetics play a role. Women with a family history of fibroids are more likely to develop them. Race is a factor, as African American women are more likely to develop fibroids than women of other races. Hormones also contribute to fibroid growth. Estrogen and progesterone, hormones produced by the ovaries, stimulate fibroid growth. This is why fibroids often shrink after menopause when estrogen levels decline. Lifestyle factors can also influence fibroid development. Obesity increases the risk of fibroids, while regular exercise may decrease the risk. Understanding the structure of uterine fibroids is important for determining the best course of treatment. Fibroids are firm, rubbery masses that are distinct from the surrounding uterine tissue. They are usually round or oval in shape and can range in size from tiny seedlings to large masses that can distort the uterus. A key feature of fibroids is the presence of a false capsule. This is a thin layer of connective tissue that surrounds the fibroid, making it easy to differentiate from the surrounding myometrium, the muscular wall of the uterus. This capsule is important during surgery, as it allows surgeons to remove the fibroid without damaging the uterus. Section 5. Degenerative changes in fibroids. Over time, uterine fibroids can undergo various degenerative changes. These changes can cause symptoms and affect treatment options. One common change is hyaline degeneration, where the fibroid tissue becomes less cellular and more fibrous. This can make the fibroid harder and more difficult to remove surgically. Another type of degeneration is red degeneration, which occurs when the blood supply to the fibroid is compromised. This can cause pain and tenderness in the abdomen. Calcification is another change that can occur, particularly in older women. In this case, calcium deposits form within the fibroid, making it hard and stone-like. Section 6. Clinical presentation and symptoms. Many women with uterine fibroids experience no symptoms. These fibroids are often discovered during a routine pelvic exam or imaging test. However, when symptoms do occur, they can vary depending on the size, location, and number of fibroids present. One of the most common symptoms of fibroids is heavy menstrual bleeding. Fibroids can increase the surface area of the uterine lining, leading to heavier periods. They can also interfere with the uterus's ability to contract properly, resulting in prolonged bleeding. This heavy bleeding can lead to anemia, a condition characterized by a low red blood cell count. Section 7. Diagnosing uterine fibroids. This section will guide you through the essential steps and procedures involved in accurately diagnosing uterine fibroids. Diagnosing uterine fibroids typically involves a combination of a detailed medical history, a thorough physical examination, and various imaging tests to get a complete picture. During the medical history, your doctor will ask about your symptoms, including any changes in your menstrual cycle, pain, or pressure in your pelvic area. They may also inquire about your family history and any previous medical conditions. A pelvic exam allows your doctor to feel the size and shape of your uterus and check for any abnormalities. This hands-on examination is crucial for identifying any irregularities that might suggest the presence of fibroids. However, imaging tests are usually necessary to confirm the diagnosis and determine the size, location, and number of fibroids. These tests provide a more detailed view that cannot be achieved through a physical exam alone. Ultrasound is a common imaging test that uses sound waves to create images of the uterus. It helps in visualizing the fibroids and assessing their impact on the uterine structure. It's a painless and non-invasive procedure that can be performed in your doctor's office. The ultrasound provides real-time images, making it easier for the doctor to diagnose and plan the appropriate treatment. Section 8. Treatment Options, a comprehensive overview. The treatment for uterine fibroids depends on several factors, including the severity of your symptoms, your age, your desire for future pregnancy, and the size and location of the fibroids. Each case is unique, and your healthcare provider will tailor the treatment plan to your specific needs and circumstances. In some cases, watchful waiting may be appropriate, especially if your fibroids are small and not causing any symptoms. This approach involves regular monitoring to ensure that the fibroids do not grow or cause complications over time. Medical management involves the use of medications to shrink fibroids or control symptoms. These medications can help alleviate pain, heavy bleeding, and other discomforts associated with fibroids. Hormonal medications, such as birth control pills or gonadotropin-releasing hormone agonists, can help regulate hormone levels and reduce fibroid size. These treatments can be effective in managing symptoms and improving quality of life. These medications can have side effects, so it's important to discuss the risks and benefits with your doctor. Your healthcare provider will help you weigh the potential advantages against any possible adverse effects. Surgical intervention is often necessary for larger fibroids or those causing severe symptoms. Surgery can provide significant relief and improve overall health and well-being. Myomectomy is a surgical procedure that removes the fibroids while preserving the uterus. This procedure is particularly beneficial for women who wish to maintain their fertility and have the option of future pregnancies. This is a good option for women who wish to become pregnant in the future. It allows for the removal of fibroids while keeping the uterus intact, thus preserving reproductive potential. Hysterectomy, the surgical removal of the uterus, is a definitive treatment for fibroids but results in the inability to bear children. This option is often considered when other treatments have failed or are not suitable, and it provides a permanent solution to fibroid-related issues. Section 9. The interplay of fibroids and pregnancy. Uterine fibroids can sometimes affect pregnancy, and pregnancy can influence fibroid growth. Fibroids can make it difficult to conceive in some cases, especially if they block the fallopian tubes or interfere with the implantation of a fertilized egg. During pregnancy, fibroids can increase the risk of certain complications, such as miscarriage, preterm labor, and placental abruption. Pregnancy can also cause fibroids to grow larger, particularly during the first trimester when estrogen levels are high. This growth is usually temporary, and fibroids often shrink after delivery. However, if fibroids grow too large during pregnancy, they can cause discomfort, pain, and other complications. Section 10. Living with fibroids, a holistic approach. Living with uterine fibroids can be challenging, but there are ways to manage symptoms and improve quality of life. Making healthy lifestyle choices can play a significant role. Maintaining a healthy weight through regular exercise and a balanced diet can help regulate hormone levels and potentially slow fibroid growth. Managing stress is crucial, as stress can exacerbate fibroid symptoms. Engaging in stress-reducing activities like yoga, meditation, or spending time in nature can be beneficial. Additionally, certain dietary changes may help. Consuming a diet rich in fruits, vegetables, and whole grains while limiting processed foods, sugar, and saturated fats can promote overall health and well-being. You need to hear this if you're a woman concerned about your health. This is a video presentation by Health Principles on uterine fibroids. Uterine fibroids are a common health concern for women, affecting millions globally. These non-cancerous growths can cause a range of symptoms, from heavy menstrual bleeding to pelvic pain. But with greater awareness and understanding, women can take control of their health and make informed decisions about their treatment. Education is key in managing this condition effectively. By staying informed about the causes, symptoms, and treatment options available, women can work with their healthcare providers to develop a personalized plan that meets their individual needs. This collaborative approach ensures that each woman receives the care that is best suited for her unique situation. Remember, you are not alone. Support from friends, family, and healthcare professionals can make a significant difference. Millions of women around the world are affected by uterine fibroids, and raising awareness can help reduce the stigma and isolation often associated with this condition. There are resources and support systems available to help you navigate this condition. From online communities to local support groups, you can find the help you need. By advocating for your health and seeking timely medical advice, you can live a full and vibrant life, even with uterine fibroids. Embrace the journey towards better health and well-being, knowing that you have the power to make informed choices. Thank you for watching.